Welcome back to Main Stage. I hope it's been a really productive few hours meeting colleagues, enjoying parallel sessions and finding out about our exhibitor partners and of course our poster presentations. A reminder that all the live sessions from Congress will join the other content on the Video on Demand tab next week. So if you want to watch anything again or indeed you've missed something, all the content will be there. I am now passing the moderator baton and welcoming back into our studio and onto your screens to lead this UK opt-out experience is Dale Gardner.
Welcome to the UK opt-out experience. My name is Dale Gardner. I'm the UK National Clinical Lead for Organ Donation and I will be your host. This special session of the joint British Transplantation Society and NHSBT Transplant Congress is being held in collaboration with the International Society for Organ Donation and Procurement, and we are being simultaneously streamed on YouTube to an international audience. Over the next 90 minutes, we will be sharing with you the story of how we introduced opt-out into the UK. We hope to do this through our guest panel discussion, videos and live links, and through interactive polls and questions. You can access the polls and questions by going straight to our Slido, and you can ask questions of our panel there. You may find it easier to access Slido by using your phone, so we stay on your computer screen and you don't lose us. Let's get started with a poll straight away. Do you think that opt-out brings benefits to organ donation in a country? Yes, no, not sure. Now, opt-out has many other names. Some people call it deemed or presumed consent or authorisation. For the purpose of this session, we will try to use the catch-all phrase of opt-out. So what do you think? Does opt-out bring benefits to organ donation in a country? And while you're doing that, I've got some homework for you. What we are going to ask you, I want you to contribute your answers to poll number 2, an ongoing word cloud, where we're going to ask the question, what do you think the legacy of opt-out is? Let me give you some background information about the United Kingdom and the UK organ donation program. The United Kingdom has a landmass of 245,000 square kilometres, or 95,000 square miles. So it's geographically small. Just look at it compared to Australia. But it has a population of 67 million. NHS Blood and Transplant is a single organisation which covers the UK, but also covers the Isle of Man, Jersey and Guernsey. So we cover 7 different governments and 7 different organ donation legislations. To tell our story today, we have divided it into 3 parts, where we're going to talk about the legislation, implementation, and the legacy of opt-out. But all good stories should start with a trailer. So to whet your appetite about what you're about to see and hear, please watch this short video montage.
I want everyone to talk to each other. What decision will it be? Let your organs go to waste or save a few people's lives?
We were all focused on one shared objective, which was to save lives and to secure more organs available for donation.
To notify the House, in accordance with the Royal Assent Act 1967, that Her Majesty the Queen has signified her royal assent to the following acts: Organ Donation Deemed Consent Act,
talk about organ donation.
Someone else may speak for you.
Well, that's a sneak preview of what you're in for. I'm joined today by my guest panel. Unfortunately, due to the current COVID situation in the UK, my panel members couldn't join me physically on stage. But can I please introduce you to my panel, all experts in the UK opt-out experience from NHS Blood and Transplant. Anthony Clarkson, Director of Organ and Donation and Transplantation. Professor John Forsyth, Medical Director of Organ Donation and Transplantation. Claire Willimont, Accountable Executive for Opt-out Legislation, and Phil Walton, Project Lead, Opt-out Legislation. Before I ask a question of the panel, I am interested in what you, the audience, thought in poll number 1. Did you think that opt-out brings benefits to organ donation in a country? Overwhelming yes. Wow, that's very good. Right, can I please remind you of our poll number 2, the ongoing word cloud. What do you think the legacy of opt-out is? Please put some suggestions in as we go through. And don't forget, through Slido, you can put in questions for our panel to answer. Anthony, as the montage showed us, since 2008, the UK has seen significant improvements in organ donation. Why was it necessary to introduce opt-out?
Well, back in 2008, we had our first organ donation strategy. And that strategy put in place the infrastructure to support organ donation. So the specialist nurses, the clinical leads, regional collaboratives, and so on. And we did see a 50% increase in donation, but that was primarily due to the number of referrals rather than an increase in consent rate. The second strategy, taking organ transplantation to 2020, we refined those infrastructure systems that we put in place. We brought in specialist requesters for organ donation, and we'd also put in place systems to recognise the gift of organ donation through a collaboration with the Order of St. John. But we still only saw a small increase in the consent and authorisation rate. So what we needed, because we'd only got so far, what we really needed was a step change, and we needed society to get behind organ donation. And that had to be led by government.
Thank you, Anthony. Well, Phil, Wales was the first UK nation to bring in opt-out. You were there in Wales when this was first proposed. What was your experience?
Well, as Anthony just said, we had the Task Force 1 in 2008, and that was closely followed by Task Force 2, which looked specifically at the opt-out legislation. And basically what it said was, no, not yet. Let's get our house in order. Let's implement the recommendations in Task Force 1 and then see where we are. But the Health Minister for Wales at the time wanted to take a different path and took a consultation to the public in 2011. And that came back really positive. From there, we supported a build process, including giving expert advice at the Health and Social Care Committee, collaborating with Welsh Government colleagues who, to their credit, took all the time in the world, really, to understand organ donation practice. And they wrote a law that reflected and complemented that practice. So from there, a detailed law that Welsh Government presented made it easier for the Human Tissue Authority to write a code of practice for clinical teams to use. And our collaboration with them really did make a difference in developing those codes. I think looking back now, the quality of that document really did help us, because we knew everybody was watching, the whole world was watching, and we were setting a template of how opt-out was going to be delivered, whether that was a template for good or a template for how to avoid doing it. But after a two-year build process, Royal Assent was given in 2013, and then started the 2-year countdown for implementation.
Right, thank you, Phil. Now, England didn't quite follow that same path, did it, Claire?
No, not quite. In England, it was actually a private member's bill, so a private member of parliament that introduced the opt-out law, although it was government-backed. But because it was a private member's bill, there was a bit of an element of luck to it, so it was literally drawn out of a goldfish bowl.
Goldfish bowl. Actually, I've got the footage of that actually occurring. Do you want to see it?
Of all parliaments, a place where the grandest traditions of democracy merge with modern thinking. They used to use a sort of paper raffle ticket system to pick out which MP would top the private members' bill list. But it was decided that was far too outdated because the paper sticks together. Now they've opted for something more modern. So here it is, the private members' bill ballot brought into the 21st century with cutting-edge technology.
As each number is drawn, I will report it and then read it out with the corresponding name of the members from the ballot book. Mr. Benja, shake your balls.
423.
423. Mr. Jeffrey Robinson.
John, as an Australian by birth, this seems a very quaint but peculiar way of doing things. Was a private member's bill actually going to work?
Yeah, Dale, I can see how as an Australian that may seem quaint, but actually the private member's bill system works quite well. It was introduced, I think, post-Second World War, and actually it was a way for legislation to bubble up rather than from government down. And so it allowed the MPs to put forward legislation that they felt was important. And as you've heard there, Jeffrey Robinson from the opposition at that time, the Labour Party, put that forward. Now, these bills have to go through the whole parliamentary process. So they had to go through the House of Commons and through the House of Lords and be sponsored by the excellent Lord Philip Hunt in the House of Lords. And really the major sort of change that happened was that around that time, Theresa May, obviously the Prime Minister at that stage, also then backed the bill. So you got a cross-party support for that bill, and that gave it a real lift and allowed it to move forward. Of course, it's fair to say that the Welsh bill and the fact that it was seen to work in the context of the UK was also a fillip to the bill. So you take all of those things together and you say this was the right bill at the right time, and it really got a lot of support to try to get through the parliamentary process.
Thank you, John. Anthony, John says it came at the right time, that England was ready for it. Why was England ready for it?
Well, Dale, I think, as John said, it was the right bill at the right time. And often when you make these changes, you push and you hit resistance. With this, they were pushing and the resistance was less. And the reason for that was because there was a driving force behind it. And that was Max Johnson's story. This was a young boy who needed a heart transplant and was on the heart transplant waiting list. And one of our national newspapers, The Mirror, got behind his story and then launched a campaign to make the legislation change. And the campaign engaged the society across England, who could actually see that there was a real person behind this legislation, and a person that engaged the hearts and minds of society. When Max got his life-saving transplants, and when that happened, the law became known as Max and Kira's Law, in honour of his donor, a little girl called Kira Ball.
I saw there was a line of ambulances lined up. And one by one, they came out with containers, and so I watched all of her organs leave, which was quite emotional. She obviously failed a brain dead test. The organ donation team did come in and just said, is it something that you would thought of in the past? I didn't feel pressured at any point. So I just looked at Kira and thought if Kira was given the option, I'm sure she would have said yes. So it was in her nature, wasn't it?
Yeah.
Yes.
Because that's just how she is. Yes, give this to whoever, you know, she's just a kind child. It's tragic, it's heart-wrenching that we've lost Kira, but unfortunately, there was nothing that could be done for Kira, but the fact that she's gone on and saved 4 other people is absolutely amazing.
I honestly was ready ready to die. I didn't think I'd make it. I hugged Mum and Dad thinking it's the last hug with my parents.
It just felt really cruel because that sparky, active little boy became completely constrained by a failing body.
This thing goes in right there.
They fitted a mechanical pump, it goes in the heart and effectively whirs around, and it whirs the blood around your body. It kept Max relatively safe whilst he waited for a new heart. Our thoughts about the donor at the time was an overwhelming sense of deep gratitude that the word thank you didn't do justice to. They've thought of others at that really difficult moment.
You going to go first? Yeah.
First of all, we need to frame this. Dear Max, I hope you are feeling much better after your heart transplant and are enjoying being back home with your mum and dad. And more lives will be saved. With lots of love, Theresa May. I love it. I remember asking Mum and Dad, could it be Max and Kira's law? And I'm so happy that they've done it. She's not saved one life, she's saved 4 people's life. She is a hero. I want everyone to talk to each other. What decision will it be? Let your organs go to waste and just decay, or save a few people's lives?
An amazing story. So Claire, I know that Scotland has also introduced opt-out. What's been Scotland's legislation experience?
Yeah, they have. It's been interesting because it's been a bit of a race to get the legislation going across all of the different countries in the UK. And Scotland actually introduced their legislation quite a while ago. So the law came into place in July 2019, but it's not actually going to be enacted. It's not actually going to come into practice until next month.
Wow. John, you live in Scotland. How has the legislation to opt out been received?
It's being well received, I believe. It feels like the right time. There are some differences in the Scottish legislation, duty to inquire and some aspects of pre-death procedures in terms of the way that is being framed in the legislation. But I guess I would pay tribute to the Scottish bill preparation team in the Scottish government. They brought consultation in early on and have reacted to that. So basically, I think that when we get the legislation being enacted just now in a few days' time, that will gain really strong support, both from the general public, but also from the clinical members who need to carry that out.
Thank you, John. Now, I have a question for you, the audience, on our Slido poll. Do you think it is inevitable for every jurisdiction that they will one day have opt-out, that every state, province and country will have opt-out? And I'm only giving you a yes or no option there. So start making your voting decision. But whilst you're doing that, we'll jump to Northern Ireland, which at one point looked like it would be the only part of the UK without opt-out. My colleague, Jill Featherstone, she interviewed Monica Hackett, Regional Manager for NHS Blood and Transplant in Northern Ireland, to talk about their experience.
Monica, welcome. As Regional Manager for Northern Ireland, can you tell us and share with us what's been happening over there?
Hi Jill, thanks very much for the opportunity to share what's been happening here. Our experience has been a little bit different from elsewhere. Just to set the scene, for those not familiar with the region, it's the smallest of the 4 main devolved administrations in the UK, with a population of almost 2 million. We're also the smallest of the organ donation regional teams, and we currently have excellent performance data for referrals and approaches, but our consent rate unfortunately isn't where we'd like it to be, despite all our hard work and the work that we've done with regard to public awareness to encourage ODR registration.
Mm-hmm. And what's been your experience of considering legislation?
Well, a private members' bill on opt-out legislation was introduced to the Northern Ireland Assembly back in 2013, but it wasn't successful. It was felt then that there wasn't enough evidence of societal readiness for that change, and there was also a desire to avoid any risk of negative impact on the donation and transplantation rates, and a desire to wait for evidence from the implementation in Wales. However, it was recognised from the results of a public health agency survey that was done then that there was a need to raise public awareness further and their understanding of donation. So instead, there was a decision at that time to legislate on the duty by the Department of Health to promote organ donation. And there then followed a public consultation around this in 2017-2018, which resulted in a policy statement outlining 2 primary objectives. The first one being around encouraging positive actions and behaviours in relation to donation. The second was around developing appropriate training for healthcare professionals. And there were 6 associated commitments alongside that, designed to drive up the donation rates. These included a long-term communications programme, working with local government and civic society to engage with the local community, and key contact audiences, which included older citizens, children and young people. So work had begun on that to deliver these objectives, and that included the appointment of a regional promotion manager to coordinate the activities.
Great, and how's that all been going?
Well, the work had been gaining momentum, and we anticipated actually using this model as a control measure to compare the impact of a focus on awareness raising and promotion against the model of opt-out legislation that had been implemented in our sister countries. However, with increasing awareness by interested parties of the changes in legislation in the other regions and lobbying from these groups, the current Health Minister made an announcement in July of 2020 of his plans to consult on an introduction of an opt-out system here. So the consultation phase of that was launched in December 2020, and it has just closed. And his aim is to make the legislation by the end of his current mandate in 2022. As a clinical team, we're keen to work within whatever frameworks agreed to deliver that additional increase in consent rates and donor numbers. And we have indeed benefited from participating in the training for the implementation of the English legislation. So we've had a flavour of the impact of the change.
Thank you, Monica. Anthony, what about the other 3 governments that NHS Blood and Transplant covers?
Yeah, so we cover the Crown dependencies of Jersey, Guernsey and the Isle of Man, and 3 islands around the UK. But of course, for NHSBT, we have to work with whatever legislation government decide to put in place. But once they've made the decision that they're going to move to an opt-out system, then we work with them to ensure it's written and formed in a way that will ensure successful implementation. So, Jersey became the second country to implement the opt-out legislation after Wales, and Jersey and the Isle of Man have still to implement theirs.
My impression through observing firsthand the UK opt-out experience is one of a ripple effect of one nation inspiring the next. Maybe this is true for the world. Let's go to our poll and see what you think. Do you think it is inevitable that every jurisdiction will one day have opt-out? Well, it's a bit 50-50, but we're going to go for no clear majority. I'm going to take our host's privilege there and go to Claire. There's no really standout there. What do you think of that?
Oh, it is interesting, isn't it? And I think every country is different, and a large part of it, I think, is maybe where the general nation support is for organ donation. In the UK, there was a lot of support. 85% of the population supported it. As John mentioned, complete cross-party support for the change in legislation, and we had through the task force the training, the infrastructure all in place. So it was the right place at the right time, with a lot of promotion and public activity. For some other countries, they may be just not quite there yet, and for others, they may not need that final push that we did as a result through opt-out. So it's it's very much a cultural thing as much as a legislation thing.
No, thank you, Claire. Phil, this might seem like a good moment to see if there's any questions from the audience. Have you got any questions you want to share?
Yeah, well, I've got to say that the chat box and the Q&A are going crazy, so thank you for the interactions already. A lot of response, actually, to the Goldfish Bowl. So what would have happened to opt out in England if our lucky ball hadn't been drawn out the Goldfish Bowl?
Well, John, can I give that one to you? What would have happened if the Goldfish Bowl didn't work?
I think, it felt like it would come anyway at some stage, but it required perhaps that obviously that would then come from a government down as opposed to from the, if you like, the public and a single MP up. I think it would have come, but it might well have taken a lot longer. And so, I pay tribute to Geoffrey Robinson, Lord Hunt and Theresa May, who actually brought that forward. And obviously the story as of Max and Kira, and that story really grabbed attention, I think, because it is such an incredible.
Passing the legislation is one thing. Let's focus now on how the law was implemented into practice. The UK had an opt-in register, the NHS Organ Donor Register. Because of the opt-out legislation, a number of changes had to be made to the register. And I asked Alex Hudson to explain these changes.
The NHS Organ Donor Register was first introduced as early as 1994. It is a single register that covers the whole of the UK. Originally, the register only allowed members of the public to record a decision to donate, often referred to as opting in. But in 2015, to help facilitate the implementation of opt-out legislation in Wales, a brand new cloud-hosted register was delivered. This new register not only allowed members of the public to continue to record a decision to donate, but also, for the first time in the UK, allowed registrants to record a decision not to donate, often referred to as opting out. By the end of 2020, over 26 million people had opted in, that's 39% of the population, while 1.9 million people had chosen to opt out, around 2.8% of the population. And so to date, some 42% of the UK population have recorded their organ donation decision on the register. In response to the 2018 public consultation to introduce opt-out legislation in England, the NHS Organ Donor Register team were responsible for delivering 3 key objectives. Firstly, we implemented a new faith declaration within the registration process. In the UK, specialist nurses for organ and tissue donation are already highly trained to ensure the faith and beliefs of a potential donor are understood and respected at the point of potential donation. It was recognised, however, that this practice was not necessarily made clear to UK citizens at the point of registration. And so, to ensure those of faith had confidence that their faith and beliefs would be respected as part of their organ donation process, we added a new faith declaration field within the online registration form. By the end of 2020, some 272,000 registrants had recorded a decision to donate and indicated that their faith and beliefs must be respected to facilitate their organ donation. Secondly, we were asked to integrate the ODR into what was then a relatively new public health app called the NHS app. The NHS app allows eligible members of the public to access a range of GP services, so integrating the register into the app therefore felt like a perfect partnership. We worked closely with our colleagues in NHS Digital to successfully deliver this integration, which allows app users to directly view and self-manage their individual organ donation registration. It was first launched in May 2019, and by the end of 2020, nearly 400,000 people have used the app to manage their organ donation decision. And we believe that over time, this will become one of the most used platforms for people to manage their decision. Our third objective was to enhance the administration capabilities of our service. In the immediate months before and after the implementation of opt-out legislation, we received some 200,000 opt-out registrations from Wales and 1.5 million opt-out registrations from England, although it is worth mentioning that these numbers represent only 6% and 2% of the Welsh and English populations respectively. Furthermore, during the peak months, we were responding to an average of 460 written inquiries per month regarding the new legislation. In May 2019, working closely with our donor experience colleagues, we also launched a new dedicated opt-out helpline, which by the end of 2020 had handled 20,000 calls in addition to the 46,000 calls received by our standard NHS organ donor line service. With these levels of activity, we had to ensure we had appropriate plans and administration resource in place such that we were well placed to be able to respond to these increased demands on our service. It's been a really busy and challenging period for the NHS Organ Donor Register, but we're immensely proud of our contribution to help and support members of the public to understand the new law and ensure they were able to easily record and manage their organ donation registration.
Thank you, Alex and team. That represents an enormous amount of work. Looks like we now in the UK have a hybrid model of opting in and opting out. I guess you could start to wonder, is it all worth it? Not every country has a register. I'm going to open up the poll again and ask, what is the best organ donor register for a country? Opt-in only, opt-out only, a hybrid, both opt-in and opt-out, or no register at all? What do you think, Anthony? Should we just abandon the organ donor register in the UK when we introduced opt-out?
Dale, I think at the time it was a really hot topic, debating how we should implement a register for opt-out. And I think one of the key issues was that we already had an opt-in register. If we hadn't have had an opt-in register, I think we would have just gone with an opt-out register. But whilst we had an opt-in with nearly, at that point, a third of the population on the register, it was felt that we should maintain an opt-in and have an opt-out as well on the register. And the rationale for that was because we know that when a loved one dies and they've made an opt-in decision, over 90% of the families support that decision. So it does make a difference to the consent and authorisation rates. And also through the consultation that was done around the legislation, the feedback that we got was that people wanted to still be able to register their decision to opt in. They wanted to be able to proactively register that decision and be proud of that decision. And also share that decision publicly. And it also allowed us to balance our marketing, and we could ensure that our promotional campaigns also matched the opt-in and opt-out registrations.
Yeah, very, very good. Let's see what you, the audience, think, and our poll result here. What is the best organ donor register? Opt-in only, opt-out, or a hybrid of both opt-in and opt-out, or no register? Well, there seems to be an overwhelming desire for a hybrid register. Claire, what are the challenges and benefits of that then?
As Anthony just said, there was a lot of feedback that people wanted a lot of choice, and from the consultation, that really came across very strongly, and people were wanting more things as well. So can we register to donate for research purposes and all sorts of things, which is great. So part of the challenge is how to get that balance right, give people enough choice, enough autonomy, but not make the form so long and complicated that nobody understands how to complete it and just doesn't get around to the end of the form and filling it in. So that brings some challenges, but I think the hybrid model brings a lot of benefits as well.
Oh, very good. So those are the benefits and challenges of the register, but there are others as well. As a clinician, we, the doctors and nurses, we're at the sharp end of opt-out legislation when we speak with donor families. Wales went first in the UK, so I've invited Dr. Paul Frost, intensive care consultant from Cardiff in Wales, to join us live and share his experiences. Paul, thank you so much for joining us. I know you were initially worried about the introduction of opt-out into Wales. Can you share with us?
Yes, certainly. Well, good afternoon, Dale, and good afternoon, everybody. I'd preface my remarks, Dale, by saying that I've always been a very keen supporter of organ donation. But you're right, back in 2015, I did have serious concerns. Firstly, deemed consent is not consent. Consent requires explanation, understanding, and crucially, permission. And I don't think that can be inferred. I was worried that soft opt-out would be an inadequate safeguard, particularly for vulnerable ICU patients, for example, those without family or friends to speak for them. And I was also concerned that the legislation might provide kind of tacit permission for a much more aggressive requesting approach by the specialist nurses for organ donation. I was worried too that the sense of gift that accompanies donation would be eroded. After all, an expected gift is not really a gift. And I think that sense of gift is very important because families, I know, derive comfort from the fact that they were able to behave in a very altruistic manner at a time of maximum distress. So I guess to summarize, Dale, I was worried that the legislation would erode public trust in a process that I'd supported throughout my career.
Thank you, Paul. So what changed your mind then? And potentially, if we had to prepare you again, what would have been better to actually have told you about in advance?
Well, 6 years of close observation and participation in the process. It's become abundantly clear to me that actually soft opt-out is an excellent safeguard because in essence it conforms to what we as doctors always do, and that's putting the wishes of the patient first. I observed our specialist nurses for organ donation go to extraordinary lengths to establish exactly what it was that the patient would have wanted. And, on reflection, actually, perhaps more so than the efforts I ever went to establish whether the patient would have wanted intensive care in the first place. My experience of the end-of-life conversations now is that our families absolutely expect to be asked about organ donation. It's completely an anticipated and expected part of the conversation. To my mind, all the legislation has done is it's opened the door to that very difficult conversation. The sense of gift is very much intact because, of course, it remains the case that this is operating with soft opt-out, so the donation remains an incredibly generous act. And as you've heard already, public confidence in the process has been preserved. The opt-outs were fewer than we expected, and in fact, donation rates have increased. So Dale, it's really difficult, isn't it, to maintain your objections when none of your concerns are realised. In terms of what would be helpful to prepare for this change, always easy with hindsight, but I think a clear focus on understanding and addressing the concerns of frontline clinicians would be a very important part of that process.
Paul, thank you very much for joining us live. Paul's experience and other clinical staff like him added so much to the way we were able to implement opt-out into England. Phil, how did you build on that sort of experience?
Well, yeah, it sounds a little bit glib to say, but the reality for Wales is that we had to live the experience and learn quickly. The English experience does have its foundations in everything we learned from Wales, from training through to marketing. In respect of training, we were able to bring through scenarios that we saw commonly, and we could show exactly how to navigate those conversations. And I think in hindsight, in Wales, we didn't start out learning quickly enough. And I think the main reason for that really was that the donor pool offered limited opportunities for that. But for England, because the donor pool was much greater, we were able to provide access to debriefs, which gave dedicated time to learn from the live environment. And with all those various scenarios coming up, we were able to learn from about how the training had landed with staff and then develop future training from that. And also with those debriefs, it offered an opportunity to provide feedback and advice and support for our specialist nurses as they headed out on the next deemed conversation. From a clinical engagement and involvement point of view, Paul is absolutely spot on with this, is that we didn't do as well as we could have done with that. And I think much of that was based around the fact that we were walking into everything we were doing was quite hypothetical. So we did need to be better from that. So for England, we took much more ownership and investment in that change process, Specifically, we instigated regular temperature checks, which gave opportunities for us to hear from the organ donation community. And that feedback then set the agenda for other meetings or engagement opportunities that we had coming up. And we were addressing those concerns based on what they were telling us.
Thank you, Phil. John, what about the transplant community engagement? I wonder if you can tell us what opt-out meant to the transplant community.
Thanks, Dale. I think I'd say two things. I'd say, first of all, every transplanter and every transplant centre across the UK wants to see an increase in transplantation, so to help the patients who are on the waiting list. So that's fine, but of course we all sharing that we would never wish for a donor to go through donation and retrieve organs from that donor unless there was a genuine wish for that to happen. And so I suspect at one stage some transplant folk required reassurance, very much in the way that we've just heard from recent speakers. But because there was seen to be that public backing, because there was seen to be that public support and confidence, then the transplant clinicians were encouraged by the new legislation. And the second thing I would say is that as numbers of donor organs has increased over the last number of years, our attention has turned now more towards utilization of organs. And so we've pivoted slightly towards that. And certainly our strategy, NHSBT's strategy, is very much more geared to not only donation, of course donation, but also utilization. And that utilization focus, judging from some of the international consultation that we did on our strategy, that change towards more interest in utilization seems to be one that's happening across the world as well. So I think support for the legislation and a pivot towards utilization would be the two things I'd say.
Thank you very much, John. Anthony, what about NHS Blood and Transplant's network of over 250 specialist nurses in organ donation? How did we engage with them and support their education and preparedness?
Yeah, it's a really important point, Dale. I think it's crucial that for the nurses that were having those discussions with families, that they were both confident and competent in having those conversations within the new legislation, but also so that they were bought into the new legislation and believed in the new legislation. So we did extensive training with them. It was key, though, of course, that our specialist nurses are involved in that conversation right from the very beginning. And we've gone a long way in developing that. However, the change in legislation meant that we could push that little bit further, because many of our colleagues in intensive care, both the medical teams and the bed nurses, wanted to bring the specialist nurses in because they could navigate through what was now quite a complicated legislation process for them and have that discussion in a much more informed way. It was, however, building on Paul's comment earlier, crucial that we provided the reassurance that families would not be under pressure to consent, and that our practice remained as best practice as a collaboration between the bedside nurse, the medical team, and the specialist nurse in having that discussion around organ donation.
Yeah, thank you, Anthony. You mentioned all the additional training that our specialist nurses had. Jill Featherston spoke with Kathy Miller, who is our award-winning education project lead with NHS Blood and Transplant.
Kathy, as head of the education delivery for the legislation change, that's a big ask. What did you plan?
So the plan was to train all 300 specialist nurses in organ and tissue donation, and to do that we needed a dedicated legislation change training team to also reach out to the doctors and nurses in critical care, and to help us we had legislation champions. We also had the opportunity to present at 2 national conferences for the Intensive Care Society and the British Association of Critical Care Nurses, to showcase live on stage the deemed consent conversation and how that fits in a team approach when discussing end-of-life care.
Excellent. So what was the strategy behind all of that planning?
The strategy was very much to learn from Wales and not to underestimate this behavioural change, to have a robust training programme and to provide debrief and support as soon as possible after the go live. So we built a very comprehensive package, starting with a theoretical module, module 1, building on that to have a very much conversational module. So building on the law and the guidance that underpinned it from the Human Tissue Authority Codes of Practice, building the conversation up in module 2, and then module 3, bringing the theory and the practical sessions together. This was all underpinned by Bloom's taxonomy, a pyramid of learning, whereby at the start we start with very basic knowledge, looking at inclusion and exclusion criteria for deemed consent, and building on how that conversation works in practice. So evaluating that and analysing it in module 2, and then building up in that really higher cognitive level of learning and having creativity. So really working out how to navigate that end-of-life care and sensitive conversation in practice. All of the modules were evaluated real time, and we built the learning in to subsequent modules.
Anthony, it was obviously important to get our clinical community engaged, but your biggest group of stakeholders was the public. So what did you do there?
So Wales went first with the marketing campaign, and that was a clock counting down to the change in legislation. But the feedback was that it didn't explain what the role of the family was in this new legislation framework, and also that the campaign wasn't very memorable. So the Welsh Government rapidly changed their campaign to a much more hard-hitting and impactful campaign, and we can see that advert now.
I've made my decision on organ donation, and I say...
Don't you touch him, he's my son!
After all, it's important that...
Dad? No!
And I really want everyone to know.
I'm his wife. I don't care what it says on his record.
Last year, more than 60 life-changing transplants didn't happen because the families of organ donors in Wales overruled their decision. So talk about organ donation.
Or someone else may speak for you.
Phil, let's just take a moment. What questions do we have from the audience for the panel to answer?
Well, yeah, there's a good question that's come in about the organ donor register. So it says that it used to be very easy to opt in, or it is easy to opt in, and you can do that by registering at the GP, driving license, all of those options. But we can only opt out online. Why is that?
Who would like to answer that? Should I pick on Claire again?
Go for it. Yeah. I think it's a fair comment, and we are constantly working on the organ donor register and making sure that we're changing in line with what works best for people. But there's concern that if you use lots of different routes for opt-out, that there's just that risk that it might get lost somewhere en route. So if it's filling in a paper form and that gets lost in the post, then we just don't know, it won't reach us. So whilst it's important to be able to have it as easy to opt out as it is to opt in, and people can still phone in, they can still go online, they can use the app, it's important also to have that safety feature built in as well.
Yeah, that's great. John or Anthony, would you like to add to that from what Claire just said?
From my point of view, I think Claire has answered it very well indeed. I think there is that safety aspect, and it's one of the things that really worries us, is to make sure that we try to get that the recording of those decisions correct. No, nothing much to add. Thank you.
Very good. Thank you. Phil, is there another question you'd like to ask of the panel?
Yeah, so although I'm asking myself a question, I guess, with this one, but it's a good one. How often did the change in law in Wales actually change the interaction of the SNOD or other clinicians at the bedside? So was deemed often applied? Okay. So based in Wales, I'll take that one. What we saw on the back of the marketing campaign, actually, many of those conversations you walk into, maybe there isn't a registration on the ODR, but the family know the marketing campaign did its job. And so you would ask families about whether there was a known decision in place. And often there was. So I think it was less than 20% of occasions where deemed consent was in play. And then you would kind of go through the process there of whether deemed consent can apply with the family. But it was few and far between to start with. I think from an English perspective, we've seen a greater proportion of the approaches have a deemed element to that, and that might be related to a population mix more than anything else.
No, thank you for that, Phil. And, you know, that's a good segue when we're talking about the campaigns that were done in Wales, because I asked Holly Mason from NHS Blood and Transplant's marketing team to talk about the English opt-out campaign.
Our campaign for England launched in April 2019, giving us just over a year to inform the public that the law was changing. Our main objective was to drive awareness and understanding of the law change. The campaign was built on learnings from Wales, from Insight and audience testing, which told us that people wanted to be told clearly that the law was changing, what the change was and how to opt out if that was their decision, all against the context of why it was changing, to save and improve more lives. Our campaign, Pass It On, aimed to educate all adults in England, so it was important we provided information online and in print using different languages and formats to ease accessibility for all. Our public awareness campaign included paid media advertising, media releases to gain broadcast, print and digital coverage. Stakeholders, partners, ambassadors and our own social media channels amplified the campaign, and we worked with stakeholders and funded 26 grassroots organisations to engage Black, Asian and minority ethnic audiences. There were two particularly challenging episodes of large spikes in opt-outs, largely driven by fake news circulating on WhatsApp. The issue here was that people were making decisions based on inaccurate information. We were able to identify that opt-outs were coming from particular communities. We implemented a number of solutions, including creating fact-based content to share with our stakeholders who are trusted voices within those communities. We planned our activity to peak between March and May. In the run-up to the law change, we were all ready to go for the 20th of May.
At the end of a rainbow, you'll find a pot of gold. At the end of a story, you'll find...
From spring 2020, the law around organ donation in England is changing. Unless you choose to opt out or in an excluded group, all adults will be considered as a possible organ donor when they die. To find out more or to opt out...
We had to stop the campaign. How could we have a campaign called Pass It On in the middle of a pandemic? We had to adapt quickly and plan for different scenarios. Implementation went ahead on the 20th of May. Our key message that the law was changing remained. And radio, as a trusted source of information, was where we took our message. Despite a jam-packed news agenda, we achieved significant coverage and our stakeholders were key in supporting our campaign. So despite all the challenges, we delivered over 140 million opportunities to see or hear the campaign through our paid media, over 5,000 pieces of media coverage, over 260 partners supported with a reach of 89 million, and nearly 6,800 stakeholders shared the campaign via their channels. All of this and more helped us to achieve 66% awareness of the law change in year against a target of 60%. But we haven't stopped since the law changed. The campaign has continued and the rest of 2020 focused on reminding people of the law change and reassuring people they still have a choice. We've managed to keep consistently high levels of media interest over the year, with several key stories, including the 6-month anniversary of the law change. And in December, we reached awareness levels of 75%.
I remember Dad's dance moves. His killer Tash. Dad was just a really happy character. I remember his smile. But I also remember when they asked if he wanted to be an organ donor. And I just didn't know.
It seems like the marketing team did an amazing job adapting and changing the campaign in light of the terrible pandemic. But it must have been very concerning for you all. It's March, the country is in lockdown, and May 20th was our go-live date for England.
Perspective, like you say, we were in lockdown, Parliament had to close, and we still had some more legislation to get through, and no idea how Parliament was ever going to sit again whilst they couldn't all actually still be in the House. So there was still very much the commitment to bring the law in, and we had to be very careful with our messaging that it is coming. We can't tell you exactly when, but it is coming.
Yeah, we also had some real concerns about training us.
Go ahead.
Sorry. Okay, yeah, so we had some real concerns about training our specialist nurses as well as updating and engaging with the ICU communities. So as transplantation began to wind down, our nursing workforce was mobilised to the intensive care units and other priority areas. And in addition to that, ITU doctors and nurses were, of course, focused on escalation and local responses to the pandemic. So we were concerned that the law coming in may be seen as a distraction or even a nuisance. And indeed, it was seen as a distraction, but in a positive way. Colleagues reported being relieved of being able to speak about something useful or important that wasn't COVID related.
Anthony, do you want to make a comment?
Yeah, only that that fake news that Holly mentioned, that seemed to increase during the beginning of the pandemic and lockdown, and we saw some real spikes. But the key there was getting underneath that and understanding what was driving it. And we did see that it was the fake news on social media. Unfortunately, because we built up those really good networks of community leaders and faith leaders and clinical leaders, we used those leaders to correct that fake news and get the correct messaging out, which was really helpful during that period.
Over to you, John.
Yeah, sorry, I was just going to say that, I mean, as others have mentioned, it was actually quite a tense time, because if in one way, if you were involved in healthcare, you were involved in a pandemic, and almost it was, we can't think of anything else at the moment. This is just so overwhelming. And on the other side, you had politicians saying, this is something that is good, that we can proceed with, that can save lives. Well, why wouldn't we go ahead? And I think one of the key times was a meeting with Claire and I and some of the politicians involved, where we realized each other's point of view. We realized that actually, unless we did proceed with the legislation right now, that actually we might lose the parliamentary time, just the logistics of Parliament at the time. And also that we could bring in the law, but with sensitivity about the way in which the law was being brought in. And it was that balance and the ability to get to that balance that allowed us perhaps to proceed in the way that we did.
Let's go back to Jill Featherstone's interview with Kathy Miller and see how the education plans had to change in light of the pandemic.
So COVID hits. How did your plans alter because of that?
So when COVID hit, the training team and the specialist nurses were out supporting the critical care staff in the intensive care units. So once we were all back, we were able to recover really rapidly. And in just 8 weeks, we redesigned the training that was built for face-to-face delivery to an online digital platform, making it very informative, engaging and interactive, so that the specialist nurses were able to engage with the training and consolidate their learning. And we met the Department of Health targets to train the whole workforce in just 8 weeks.
Wow. So what do you think you'd take forward with all of this learning?
So the key parts of the success story are working under a project framework, being able to develop, test and deliver the training, and working as a dedicated legislation change training team and project team closely with our operational colleagues and the wider education team, and having a really collaborative working relationship with our regulators, the Human Tissue Authority, so that the codes of practice that were built are meaningful in the clinical context, so they underpin the law, and having all of these resources that we use throughout the project available in one place. So all the videos, all the training materials, all the documents and resources are accessible to our workforce.
Now, COVID affected plans for Scotland's go-live date. Their legislation had gained royal assent in July 2019, and they were due to go live in the autumn of 2020. I have Susan Hanna, Regional Manager in Scotland for NHS Blood and Transplant. Susan, can you please update us on Scotland's progress and current plans?
Good afternoon all. Progress in Scotland, all things considered with the pandemic, is going well, and the delay of the law change did provide us with more time to prepare and to revise our training programme and deliver online. A masterclass of training began in September last year with the clinical leads, specialist nurses for organ and tissue donation teams. This model of training is currently being cascaded to the intensive care units and emergency departments in Scotland's hospitals. More recently, further advanced practical training sessions were provided to the specialist nurses for organ and tissue teams. In addition, we have an interactive e-learning tool around the law change and available for anyone in the UK to freely access, but it's primarily designed for professionals whose roles require knowledge of the new Scottish opt-out legislation and implications for their practice. Again, this extra time was beneficial for this to be developed. On a separate project, use of the information digital tool in Scotland has proven helpful during the pandemic, and supporting donation conversation for families restricted from visiting. Visual donation information is provided with a QR code that families can share and watch together, creating a cultural awareness, which may prove valuable as we go live. With regard to the current plans, we now have less than 30 days to go. Public information campaign is well underway with TV adverts, radio stations, local and social media channels. A slightly different approach was taken in Scotland with providing a letter drop of a law leaflet, recently posted to all 2.6 million households, with 20 different language options available, as important to reach as many different communities as possible. We are very grateful to the England and Scottish Government opt-out implementation and project teams for their collaborative and shared learning with us. Thank you, Dale.
Thank you very much for joining us, Susan. Best of luck with your launch, March 26. Now, clinical teams and the general public are not the only groups that needed to be involved. Claire, it was mentioned earlier when we were talking about the organ donor register change that Alex told us about, that there was a strong engagement with faith groups. I want to come back to that now. That's really important. What did that involve?
It was a really important part of everything that we did, and one of the benefits that the law change brought is that it really raised organ donation and that organ donation discussion up the priority list for a lot of different groups, and it meant that it opened some doors and raised that priority. So we went and spoke to a lot of different faith groups, and we went in with a very humble approach and just asked, explain, this is what the law means, this is what organ donation process means. What do you think? What are your concerns? What are your considerations? And it was just very much a discussion, a collaboration, dispelling a lot of the myths and supporting those faith groups to understand what the organ donation system was and how that might fit in with their faith or their beliefs. And that's brought real benefits on both sides. For us, it led to some really important changes. So the organ donor register now includes options about recording faith and stating that that's important to you. You can see there we brought in faith-specific organ donation cards. It's allowed those people to have conversations themselves, and again, peer educating. And it's brought benefits for NHSBT as well. So it's really strengthened the training that we can give to our specialist nurses so that when they go and have that discussion, they can come from a better understanding of whether that individual had ticked the faith option on the register, but also what faith and religion might mean for organ donation for some people.
John, do you want to make some comments?
Thanks, Dale. Yeah, I think this was one of the key points for us was the collaborative effort that there began to be between us from our sort of, if you like, service side and the faith belief and also ethical groups and bioethical groups that also had very strong views. And we had, as Claire said, we had multiple meetings, and out of those meetings built a relationship. You know, the very fact that we were prepared to meet people halfway, or indeed to develop things such as those faith-specific cards, that was a demonstration from our side of our intent. And it began to, as I said, build those relationships and allow a real collaborative viewpoint on the way in which the legislation was going to be and the way it was going to be interpreted. And I think it's fair to say, I mean, at this stage we were getting quite close to, will the legislation go ahead or will it not? And we often said that even if it did not go ahead, even at this late stage, the trust and collaborative effort that had put in because of that, those lots of extra meetings and discussion, that alone would have been an incredibly positive thing. And of course, we ended up with both things, both that incredibly longer relationship, but also the relation.
No, thank you, John and Claire. I'm sure it is obvious to our audience just how huge and massive moving to opt-out has been for the UK. From where we stand now, I'm interested in exploring the legacy we have built. Don't forget our ongoing word cloud on Slido, where you can answer this question: what do you think the legacy of opt-out is? A question many of you may have is, does it work? Is all this effort worth it? Does opt-out increase consent and authorisation rates and increase donor numbers? Joining us live is Sue Madden from NHSBT Statistics. Sue, has opt-out made a difference?
Thanks, Dale, and good afternoon, everyone. So I'm here to talk about the impact of opt-out legislation in the UK in terms of the data. So starting with Wales, in a population of 3.1 million, there are currently 42% of the population who have registered an opt-in decision on the ODR. 6% of the population have registered an opt-out decision. The post-legislation consent rate in Wales is currently 69%, and in the last financial year, we saw a consent rate of 71% with 27.1 donors per million population. Excuse me. To formally evaluate the impact of opt-out legislation in Wales, we designed a prospective sequential study, the details of which can be found in our paper published last year. But essentially, we compared the cumulative consent rate in Wales with that of England on a quarterly basis and plotted the test results on a chart like this. For our DBD comparison, you can see the results here. And we observed in the 11th quarter, towards the end of 2018, the plotted points crossed the upper boundary, which indicated that for the DBD consent rate in Wales, there was a significantly higher consent rate than England. For our DCD comparison, we didn't observe the same effect. And in fact, our study concluded that there was no significant difference between the two nations in DCD consent. However, we then went on to perform a retrospective risk-adjusted analysis. And the results from this, we observed that the chance of consent in Wales actually increased over time relative to the chance of consent in Wales. And we can see this in our odds ratio plot on the right-hand side, the increasing chance of consent, such that in 2018, the final year of the study, the chance of consent in Wales was significantly higher than that of England. And this analysis included both DBD and DCD donation. And what this implies is that the impact of opt-out legislation in Wales actually increased over time, and there was the impact, was not immediate, and therefore there's some delayed effect. These results are also published in our paper last year. So moving on to look at data from England. So in a population of 56 million, currently there are 38% of the population who have registered an opt-in decision and 3% of the population who have registered an opt-out decision. The post-legislation consent rate in England is 69%, and in the last financial year, which was pre-opt-out in England, the English consent rate was 68%, and there were 23.5 donors per million population. To evaluate the impact of opt-out legislation in England, the study design differs from that of Wales, and that's due to the fact that we don't have a convenient control group. So in this study, we plan to compare the observed consent rate under opt-out legislation with an estimated baseline consent rate without opt-out legislation. To do this, we take the last 5 years' worth of data to estimate our baseline consent rate, and then we're aiming to detect a 5% increase in that rate under opt-out legislation. Allowing for the bedding in period we observed in the Welsh data, we'll be performing our final assessment in England 2 years post-implementation. The plan to evaluate the impact in Scotland follows the same study design of that of England, with the exception that due to the small numbers in Scotland, we require 5 years' worth of data to be able to detect a 5% increase in consent rates from the baseline rate. Therefore, allowing for the 2-year bedding in period plus the 5-year study period, we'll be performing our final assessment of opt-out in Scotland 7 years post-implementation. So in summary, there is evidence of an increased consent rate in Wales under opt-out legislation for the duration of our study. The evaluation of the impact in England and Scotland is expected to conclude at 2 and 7 years post-implementation. However, the assessment of the new legislation in England and Scotland, we know, will be complicated by the unknown impact of COVID pandemic on UK consent rates. And it just remains for me to say thank you to the specialist nurses for organ donation for the provision of the data, without which this analysis would not be possible. Thank you.
Thank you, Sue, for joining us. Donation is not just about numbers, it's about people. And we recorded Kathy Rumbelow, one of our specialist nurses, talking about the changes that she and the other nurses have experienced since the introduction of opt-out into the UK and how this has affected the legacy of how they speak to donor families.
We came together as a team and looked at where we were, where we had been, and where we wanted to be. We wanted to be a success, to lead the way to make this work. There was intense scrutiny on us. The eyes of the whole nation were indeed on us. We worked very hard as a team. We looked at all aspects of communication. We became masters and experts. There was amazing commitment from the team, sharing of practice. We explored different scenarios, lots of role play. We had increased training from different communication experts, for example, hostage negotiation and linguistics. We became a team of highly trained specialist nurses, empowered to have difficult conversations with families. We now see acceptance in hospitals and from our colleagues that a referral to the organ donation team is a normal part of planning end-of-life care. We are seeing families that are expecting to have a conversation about organ donation. Indeed, many families are bringing up organ donation themselves. They are asking to speak to our specialist nurses about organ donation. We are empowered to have difficult conversations with families. If there is no decision registered, what does this mean? We explain that not registering a decision leads us to believe that there is no objection to organ donation. There has not been an opt-out decision. People's decisions are being discussed openly and respected. Families see our commitment to get it right for them. What we must realise is it's not about us, it's about that person's decision. Opt-out legislation is not simply a change in the law, it's giving more people more options to share their decision. It gives families as well as specialist nurses more ways to discuss organ donation. We see families that are very proud of the decision their loved ones have made. It is the most amazing gift a person can give, the gift of life to others. The greatest sense of achievement of being a specialist nurse is not always about seeing figures going the right way. It's about listening to people's stories, knowing lives are being changed and saved, the huge differences being made, and the importance of having big, bold conversations with families. The opt-out legislation empowers us to do this confidently and successfully. It gives me an enormous sense of pride to be a specialist nurse within the South Wales team.
Thank you, Kathy. But what about donor families? How does opt-out affect them? I asked Joanna Duckworth, whose husband Scott donated in 2016, to talk about her experience. Joanna was one of the first families to experience opt-out legislation and practice in the UK.
We come from a small village outside of Llanelli in Wales. At the time, I had been married for 10 years. We had an 8-year-old son, Archie, and my eldest son was 21. It was a shock when I was contacted by the police whilst I was at work. They said they had found Scott unconscious and he needed CPR. They had called an ambulance and they were taking him to hospital. I was scared. It was only 5 minutes away, but it was the longest 5 minutes ever, and waiting to see him felt like an eternity. Scott had been in intensive care for 2 days before the doctors told me that there hadn't been any improvement in his condition at all. He hadn't shown any signs of anything. They were going to do some tests, and they thought then that they would confirm that he had died. I knew he wasn't coming back. When the doctors confirmed it, Scott had died. There was a specialist nurse. They asked about organ donation and spoke about the legislation change. I had seen a couple of posters on buses, but hadn't taken any notice of that at all. In my mind, I thought this was something that they must have asked everybody. I wasn't even sure that Scott's organs would be useful for anybody. But the specialist nurse said that it would be possible for Scott to help a few people. We had never spoken about organ donation, and he had not registered his organ donation decision. So the specialist nurse explained that consent could be deemed under the new Welsh legislation. I knew immediately it was something I wanted to support. Scott had once said that if ever his kids needed anything, he would give it to them in a heartbeat. So I thought, why would that be different for anybody else? It was the quickest yes I have ever said. I was able to spend time with Scott and have some mementos, knowing that the specialist nurse would keep his dignity and be with him all the time during the donation. They called me later to say that he had been able to donate his kidneys and his liver. Even now, 5 years on, every time I receive an update on the recipients or something from the organ donation team, it brings a smile to my face. I am so happy that Scott was able to donate, and it brings me, my family and our community so much comfort that he has saved other people's lives. He is our hero.
Thank you, Joanna, for sharing your story with us. Turning now to our Slido word cloud, this is what you, the audience, suggested the legacy of opt-out is. Panel, what lessons would you wish to share with our international friends? If you knew then what you know now, what would you keep? What would you do differently? Shall we start with Claire?
Yeah, for what I would keep and definitely recommend for anybody else that's thinking about heading down this road is the stakeholder engagement. There's no shortcuts. You have to get out there, you have to talk to people, you have to listen to them, and you have to act on what they say. That collaboration, that relationship building up has been incredibly helpful, not just for the law, but will carry on being helpful for years and years to come.
Oh, fantastic. What about Phil? What would you say?
Well, I think we've done this 3 times. It will be 4 in the next month, 7 times by the time we're finished. And we're confident now with each iteration of delivery that we've got a robust training program and an engagement approach. The one thing I think I would say to anybody moving forwards is take your learning opportunities as quickly as you can. If you can debrief as soon as possible after deemed conversations with specialist nurses, do it. Every approach is different, and it's fascinating what you can learn from those conversations.
Thank you, Phil. John, some final comments from you?
Thanks, Dale. I guess one of the things that we wouldn't do is have a pandemic right in the middle of trying to put the legislation in place. But that's an obvious. I suppose I would say that, first of all, any country that hasn't got deemed or opt-out in place, you would say let's make sure that there is a fertile ground there and there is a general support. And then when you do this, it's going to be a flick of the switch. I think some legislators that I've spoken to in years gone by felt it would be a flick of the switch. Of course, I think you've demonstrated very well that there is a lot of activity that needs to happen, and that a lot of the engagement that Claire referred to was vital in making it hopefully successful. But if you do that, then it will be an incredibly positive thing for the country and for organ donation and transplantation, but most of all, perhaps for the patients on the waiting list.
No, thank you, John. Anthony, some of your final reflections?
Yeah, thanks, Dale. I think if I was going to say what to keep your nerve is what I'd say. I think, and the team did that incredibly well, Claire and John particularly in the difficult times. But no, seriously, we've been on an incredible journey. It's been really nice actually for the last hour and so to reflect on where we've come from. We've learned so much from those early days in Wales and built our confidence over the time. And I think now, we're really confident in this legislation, and also that society is supporting us in implementing it. So I'd just say that we're here, we're happy to share any of our knowledge, anything that we've been through, we can share it with any colleagues around the world. We're a small community that are thinking about this, and I'm sure the whole team is happy to share our experience with them.
Thank you very much. Before I share some special footage with you, we're just going live to Susan Gunderson, representing the International Society for Organ Donation and Procurement.
Thank you, Dale, and thank you for this invitation to be part of this really incredibly amazing session that you have hosted. Congratulations on the session. We all know that donation and transplantation is a highly integrated, highly complex process and system. And we've heard today about the community engagement, the social and marketing needs, the political and legal systems that need to go into this process. And we've learned that once again, we are reminded that the miracles of transplantation can only happen through the kind of engagement that we've seen on the donation side. We've been watching from a global perspective about the experience in the UK, and we're really grateful to have heard your story and appreciate the openness and learnings that you have brought forward. I'm the past president of the International Society for Organ Donation and Procurement, and we are very honored to be part of this process in sponsoring this session today. The ISODP is the only organization internationally, professionally, that's focused on advancing donation from a global perspective, building a network of experts in this field, and improving practices across the world. And this session is one that has brought so much learning for all of us, and we're very, very grateful for that opportunity. For those of you who aren't familiar with the ISODP, I would like to extend a welcome to join our organization and to become involved in this international work, and to extend a hearty welcome to our next International Congress to be hosted in Las Vegas, Nevada, the end of this year in November. Sponsored by the Nevada Donor Network and hosted by the International Society for Donation and Procurement, it is the global opportunity to come together and share more learnings. So finally, I would just like to extend my thanks once again to participate in this session through the ISODP, and thank the NHS Blood and Transplant, as well as the British Transplantation Society for this unique collaboration. Thank you, Dale.
Thank you, Susan, and I hope we all would get to go to Vegas and see you there, COVID willing. As we close, I would like to express my thanks to the International Society for Organ Donation and Procurement, the British Transplantation Society, my panel, my guests in the session, Jill Featherston and Charlotte Silver, who worked incredibly hard behind the scenes to make this happen. But a big call out to all the individuals and teams throughout the UK that have successfully delivered opt-out. But most importantly, I would like to honour and thank our donor families, without whom there is no transplantation. Finally, I did wonder whether you wanted to see how Max is going. This is Max on his 13th birthday in January.
Happy birthday, dear Max.
That looks cool.
Happy birthday to you.
Yeah,
Oh, wow.
How does it feel then to have turned
13 to be finally to be a teenager? How does that feel?
It feels really good, because I thought about 4 years ago that I might not make it to this point, that I will never experience it. It's nice, and it's crazy thinking that it actually went down 4 years ago.
It is 4 years, isn't it, since you had your transplant? And how would you describe those 4 years?
To be honest, at first it was a bit rocky, but I think as life's gone on, it's gotten good.
Yeah, and how are you feeling at the moment?
I'm feeling great.
Feeling really positive off the back of an excellent Christmas and a fantastic birthday as well.
How does it feel to have had that gift of life?
Incredible. It's like a second chance, and now I'm getting to do what I'm doing now. Have a blast.
Howard, by a donor heart.
Thank you for sharing mine and Kira's story around the world.
So wherever you are in the world and whatever time zone, thank you for watching. We hope you enjoyed the UK opt-out experience.